to get your inputs and work on a change, because research within SCOPH is something very crucial and something that it wasn't ignored, but the research team of SCORI took always the upper hand, neglecting that it's something individual based. Someone will go to a research based program and come back again, but not animal based or globally actually based on the IFMS A level. So we're trying to make concrete steps on the initiation of that part in research in public health. And I'm going to update you for sure on the server.
Okay, thank you, Maya.
You're welcome.
There was also another question, which was from Kira. How can we publish research if we combine work of NMOs? Because to do research with SCOPH activity gets a bit difficult and tricky.
Actually, the research itself will be based on the activity, so it won't seem tricky. For example, you're going to implement an activity to that has an end goal of the reduction of tobacco use, for example, in a certain open area, for about 10% in 6 months, for example. So you're going to start assessing the tobacco use percentage, for example, or tobacco use users in that area. Then working along with your activity, you're going to assess the your impact, then your end term impact in comparison to your end goal. So making it quantitative, I believe IFMSA will publish toolkits and manuals for NMOs to use, but again, it will be NMO based or activities based. Okay. Are there any questions?
All right.
Any more questions?
Thank you, Amaya. I'm really sorry for my mistake, but it seems that audience has missed some of the presentation because we were not broadcasting yet. Do you mind just presenting like briefly what you talked about during the presentation once more? Just like shortly. I'm really sorry.
No, it's totally okay. So,
all right, so
at first,
I'll start
yeah.
the screen share again. Okay, I'll share the screen again. And there, I hope you guys are seeing this time. I think you can start from what the program is and the activities and topics that fit in.
Yeah, okay. So what I said about the program is that you have to know first what are the non-communicable diseases. So there are 4 major diseases recognized by the WHO, which is the World Health Organization, and they are cancer, cardiovascular diseases, respiratory diseases, and diabetes. And there are 4 recognized modifiable risk factors for all those diseases, which are tobacco use, excess alcohol use, physical inactivities, and unhealthy lifestyle or unhealthy dieting. So the program itself is calling on the reduction of non-communicable diseases through targeting specific population. Those specific population might be people at risk, elderly, adolescents, according to the specific non-communicable diseases or risk factor tackled. And there are other methodologies, whether population outreach, advocacy efforts with multidisciplinary approach, with joining governmental bodies, for example, or joining international acts toward the problem. So you will find some links for the baseline assessment reports. I encourage you to read it to know where we stand on the international NMO, or even the local level, you will find different examples for NMO's activities, and what we found lacking and what we found really encouraging us to have that solid program talking about non-communicable diseases and healthy lifestyle as the first program for the SCOPH Heroes internationally. So we can jump to slide, I guess, 7. Or do you want me to explain any of the previous slides?
Just like one sentence per introduction, maybe.
Okay, great. So for the baseline assessment, where you will find the link in the conversation of that talk, it gives the start line, or for example, the point where we are explaining where we stand when talking about actions combating NCDs and promoting for healthy lifestyle, whether globally, nationally, or even locally. In the baseline reports, you will find too many examples about activities on the international level. So for the next slide, it gives clues about what IFMSA has been doing lately. So since 2014, all GAs, General Assemblies, and regional meetings talked about non-communicable diseases, whether through having an external or discussions, small working groups, spreading toolkits, and giving webinars to the members to know more. And for the externals wise, IFMSA joined 2 official collaborations, one with the World Health Organization in a global coordination of non-communicable diseases mechanisms, and another cooperation with the NCD Alliance, which is an NGO talking about non-communicable diseases. On the NMO level, 80 NMOs actually worked on non-communicable diseases, which is a vast, huge number. And there were regional preferences for every activity, whether through population outreach, which was more noticed in the EMR region, policy making and decision making, which was found more in the European region, and also for the diseases wise, like the Asia Pacific region worked more on tobacco and colon cancer, but the Americas worked more on obesity, and Canada worked more on skin cancer. So through those preferences, we also find common work, which are the celebration of World Days. For example, 74 NMOs celebrated the the last World Diabetes Day, and other peer education methods to educate medical students about the structure of NCDs. It's working on most NMOs. Those 2 figures explain more about the relative work on each non-communicable disease or each risk factor. So, for example, people work more on educating people about the harmful use of tobacco instead of educating them directly about respiratory diseases. Very few animals talked about the excessive use of alcohol, but yet it's something that should be addressed. So going to slide number 7, what kind of activities that actually fit in the program. This is a very, very, very simple thing to be done. I hope the figure is obvious for you all. It states that any activity that has the end goal of the reduction of non-communicable diseases and is working systematically, starting from the capacity building of members and the team building that will undergo the other methodologies, then taking either ways of campaigning and population outreach through primary and secondary health education approaches, whether raising awareness or early detection through screening, or the second way which spots the decision making through joining governmental bodies, for example, through announcing a policy statement and working on it. But all those things things must have that end goal of the reduction of non-communicable diseases. You will find the enrollment form link I shared in the conversation. If you have an activity that has that end goal and is working systematically, you can have the overview on the enrollment form and fill it. You don't have to be like covering every single aspect of the enrollment form, because be sure that the program team will help you enriching your activity. So there are no rejections, but yet your activity may be postponed for a little time until you enrich it by the advice of the program team. So it's not that hard, because working your activity to get affiliated will have too many advantages. Being more efficient, because it will be tracked by the program team, so any deviation within the methodology or the end-term goal will be spotted, and you will be alerted with it. So your activity will be always meaningful and enriched. Getting funding opportunities, whether nationally in your country through having a solid proposal stating that you are affiliated from an international students-run organization that represents all medical students all over the world, is a certain asset in your proposal. And again, if IFMSA got a grant on the reduction of non-communicable diseases, you will have a part of that grant to work in your activity. So your activity will be truly more flexible in your way that you want to implement it. And for the collaboration between other NMOs, sorry?
Thank you, Omnia. I think that would be very enough. Thank
Yeah.
you very much, Omnia. I'm sorry for making you repeat again.
No, it's totally okay.
All right, thank you. Thank you, Omnia, for a very, very good presentation again. I would like the audience to take the keynote message that the NCD and Healthy Lifestyle project enrollment for your NMO is open. You can see the enrollment form on the comment room. I've already shared it before. So try to enroll your project in your NMO, because you will find more funding opportunities, collaborating opportunities, and more database and external opportunities. Also, Maya here is planning to share a ultimate program manual, so do wait for that to come. And to hear that there were regional differences in the NCD projects. For example, European NMOs would have more tendency to focus on policy change. On the other hand, EMR NMOs would rather focus on population-based project activities. And I also heard that Asia Pacific NMOs have the tendency to focus on the topic of tobacco and colon cancer, while American NMOs will focus on obesity, right? And yeah, that would be all for Mbeya. I would like to move on to Mika now, since we're a little bit behind of our schedule. Thank you, Omnia, again very much for your wonderful presentation. And Miki, I'm sorry for postponing your speech. Okay, you can go
That's
on
okay.
now.
Hello? Oh, there. Hello, can you hear me?
Yeah.
Yeah, okay, so we have a lot of projects under that we don't follow strictly the IFMSA program. So a lot of our projects have fall under different programs. So for AMSA Philippines, I'm sure we have a lot more that fall under NCDs and Healthy Lifestyle, but I'm gonna present just two. And then, okay, here. Wait. All right. So the first one is going to be the community health fair that happened last January. So the ultimate goal of this was not really to directed towards NCDs and healthy lifestyle, but to um, change the thinking in the community through health education. But one of the objectives, the main objective was to promote health awareness on primary and secondary prevention in the community. So it touches upon healthy lifestyles as well. So I'm just going to show you guys some pictures of what happened during the community health fair. So the health fair was done in a community here. So the main target was mothers, pregnant women, mothers, children, and then the elderly. So there were 6 booths, namely health financing, maternal health counseling, maternal health services, general health services, nutrition, and physical fitness. So we touched upon a lot of different programs, but NCDs and healthy lifestyle is part of it. So, okay, I'm just going to show you pictures. These are what happened. And then for here, we performed it's something like a medical mission but with health education. So we taught the members of the community about proper nutrition, importance of physical fitness, and so on and so forth. And then for mothers, we even gave them reminders here. That's a fan they can use, and as well as read something like prenatal counseling. It includes reminders about how dangerous it is to smoke or to drink, or what to do, what not to do during pregnancy. He is a fitness booth, so they performed. No, these are medical students, and then they danced with the members of the community. So those are children from the community, and then we also taught the children proper hand washing. So that's the first program. And then the next program will be our social media campaigns. We have a lot of social media campaigns that relate to health and wellness. So one of right. So our social media campaigns aim to promote awareness on various public health related topics through social media. And one of these topics, hello?
Yes, go on, Mika.
Oh, okay. Okay, so I'm just going to show you samples of our infographics that were released last year. So this is about tobacco control, um, asthma, there. So it's not just about NCDs and healthy lifestyle, but it touches upon communicable diseases as well, and then mental health issues. There. And there, that's it.
All right. Are you done with your presentation, Mickey?
Yeah.
All right. Okay. Thank you. Thank you very much. I've always liked all the infographics from Philippines. I don't know how they make it so wonderful all the time, but it's really, really nice. I think you can also consider enrolling your projects activities to the IFMSA NCD and Healthy Lifestyles program. It's very nice to be so. I think it will rather profit IFMSA more than you can actually profit from the IFMSA. But anyways, if anyone has questions to Mickey, you can type it on the comment chat. Meanwhile, I would like to move on to our next speaker, Ja from Thailand, Azrina from Indonesia. Azrina?
Me or Tim first?
Azrina first. Thank you very much. Thank you, Miki, and we'll now move on to Azrina. Azrina, you can start with your presentation.
Okay. Okay. Good night, all. My name is Ajina Rasrum. I'm the NPO from Indonesia. So tonight I will present about our next project, which is World Diabetes Day 2015. So first, our this year goals is raising awareness of diabetes in community and medical students. And the second is improving knowledge regarding lifestyle and healthy eating along with ways to prevent diabetes and its complication. And educating and promoting healthy lifestyle in order to prevent diabetes. And then our theme this year is healthy living and diabetes as the World Diabetes International this year's theme. And our but what different from our previous year World Diabetes Day is our target. So for this year, our target is a community, especially who live in the village. So why we choose this target? Because we consider that in Indonesia, the people who live in city is already quite aware about diabetes, but the villager is not really know about the diabetes and how to live with that and how to control with that, because in our culture that the food is very rich in carbohydrate and fat, so that we think that the villager in Indonesia is needed more a program rather than the people in the city. And we took the program for the World Diabetes Day from September to November. Why it took so long? Because in this year our project is formed in the sustainable project, which we uh, the requirement for the project is like at least in each local that we should having 3 series of event, the minimal for sustainable project. Why we took sustainable project? Because we think that usually the World Diabetes Day is only just like celebrating event. It's just 1 day event. So we think that it's not enough to have a real impact on the community if we only do it for 1 day. So for this year, we changed it into sustainable project, and the participant is 18 universities in Indonesia, from Sumatra, Javanese, and for our external partner, we are collaborating with the Persadia. It's like Indonesian Diabetic Association. And then what we do to our local is we provide our NMOs made our own guideline, which is World Diabetes Day Project Guideline. And we also are having a chat meet via Skype with our LPOs, and we do event supervision, which is a university visit. And the event series is we do some of this. The first is pre and post project questionnaire. Why we do that? Because as years goes by, we need to provide some valid data to know what exactly the community need and what impact we get after the program ended. And then we will make a talk show in the village, and then the other event is we having healthy 10, the blood pressure, blood sugar, and BMI checking, and then the cooking competition, and then the diabetic exercise, and then after that we go for evaluation and the follow-up. And what is our success indicator is the all series of event run smoothly as planned, and the event participants varied with age, which including father, mother, and children, because we targeted in the villagers, so we have expect a full family member, and then the event participants can be more aware and have a better knowledge about diabetes after World Diabetes Day. And the last is the medical students involved in this event have a better counseling and basic health examination skill. So, and the other thing that we want to do is a campaign, a national campaign. We haven't already yet think what the detail about the campaign, but we would love if there are other NMOs that wanted to collaborate with our NMOs, so it will make a bigger impact on the community. And this is our previous World Diabetes Day in the last year. You can see it. And then there's also that's all my presentation. I hope it will be useful for you, and I would love if you having on the same plan for having World Diabetes Day, and we can collaborate together. Thank you.
All right. Thank you, Ajrina. Thank you very much. I am wondering if there is any NMO in here, if they have a similar project. I am pretty sure there would be a few similar projects in Asia Pacific on diabetes campaign. Also, I would like, I heard that there is the success indicator, but I would like to know if there is any quantitative measurements you are planning. Ajrina?
Okay, Royun. So I plan that we have 18 university, and I plan that every university have like 200 until 300 participants. But the questionnaire itself we haven't provided yet, so we only count the successful indicator for now. We just count it basic on the how many participants that involved in this World Diabetes Day. That's all. Thank you.
All right, thank you, Ajrina. Thank you for your presentation. I would like to hear from the audience if they have any similar projects in their NMOs. I'm just waiting for their comments. Meanwhile, we'll just move on to the next speaker, which will be NPO representative from Thailand, Judge Doppa.
Yes.
All right, you can start your presentation now.
Today, I will present two projects, and my friend Chotika will be the first speaker for IMSA Thailand.
Okay, Chotika, would you like to go on?
Okay. Just wait a minute. Okay. Can you hear me?
Yes, we can hear you. Do you want to share your screen so we can see the presentation?
Oh, I'm sharing it. Can you see? I'm sharing my
I think you need to
presentation.
press one more button. If you press screen share, you will see share with all or something. Do you see it?
Um. mm,
If you press screen share, you will see on the top there is a bar that comes down, and you should press present to everyone.
Okay. Can you see it now? I already. Um,
Can you try once more? If you press screen share, you will see the bar coming down from the top of the screen, and you have to press present to everyone once more. Do you
again.
see it?
The green button, right?
Yes.
Um.
Press the green button on the left, and then click the presentation, and then you will see on the top there is a bar, green bar that's coming down. And you will see the button present to everyone.
Yeah.
Can you click that? If you're having trouble, I can share your screen for you.
Um.
Guys, can you see my screen?
I'm.
Can you see my screen?
Yeah.
Okay, everyone can see my screen? All right.
Yes.
We're gonna move on with this. Chutika, you can
Okay.
start.
Okay. I use your screen. Okay. So, hi everyone. I'm Chotika from IFMSA Thailand. We are working on a project called Food Step of living a healthy life is to eat healthy food. So, um, there are common excuses for not being healthy or being in shape because of busy schedule. Can you move to the second slide? Hey,
Chutika? Shrutika? Hello?
Hello.
Um,
Can you see the screen now?
no, I don't think so. Hold on. I think we can. Your screen is just flat. No, we cannot. We cannot see your screen. Your screen. We're just gonna move on with mine. Can you keep going on? Ah, okay. I think we're having trouble with Shrutika. Ja, could you do yours first? Hello?
Yes.
Yes, Ja, can you move on with your presentation first?
Okay.
All right.
Um, can you see my screen?
No. Yes, now. Yes, we can.
Okay, so um, hi everyone. My name is Ja. I'm the NPO from APRM Thailand. Oh, today the project that I'm going to present is called Neighboring Health Idol Project. Our NMO plan to start this project after the project that Shrutika is going to introduce you. So now not much details to discuss about this project yet. So what is this project is about? It's about setting our health adult contest in the community to seek for in by this health idol we mean a person who lives a healthy lifestyle and also who can inspire other people to do the same. So why do we come up with this project? Well, people normally have excuse for not exercising or not having healthy diet, like they are too busy or like there is no fitness in their neighborhood. So um, we want to we want to encourage them to exercise more. We believe that people would be more encouraged to do something if they have someone as their role model, especially someone who is close to them, like having a same job or having a same age. So we want to set up a health idol contest in the community to find that role model. The objective of the project is to encourage people in the community to have a healthy lifestyle, to share and exchange ideas of healthy lifestyle between people in the community, and the extra objective is also to develop interactions between people in the community. So for the preparation plan, first we'll find the communities that will accept this project, and we plan to choose the community in Bangkok, the capital of Thailand. Then setting a criteria and rewards for a health idol contest. And one criteria is that they have to have good performance from the health checkup programs. And also we would like to set up an exercise workshop. So the all-day event would be something like this. In the morning, the basic health checkup program and the registration for health idol contest and the interviews for all the applicants. In the afternoon, we will have an exercise workshop and recreation activities. And in the evening, we will announce the winner of the health idol contest and let the winners give an inspirational speech on how to live a healthy lifestyle to the people in the community. Okay, so that is now all about the projects. Thank you.
All right, thank you. Thank you, Ja. Do you guys have any question for her? Alright. Also, I would like to hear if there is any similar kind of project in your NMOs. Feel free to comment anytime on the comment room. Now we're going to proceed to Chutika. I think Chutika is ready to share her screen. Chutika?
Okay. Um, can you see my screen?
I think so. Yes. Can everyone see her screen?
Okay. So I proceed my presentation. So the common excuse for not being healthy or being in shape are because one's busy schedules, loads and loads of work, therefore there are no time for exercise. But exercising isn't the only factor of staying healthy. What do we eat today? So we today junk food business is becoming huger and huger around the world. People stop eating natural food. Instead, they aim for these unhealthy food due to various reasons, because it's delicious and sometimes it's cheaper, but most of the time because it's convenient. It's everywhere and you can just grab and go. But these benefits come with consequences. One main consequence we face today is obesity. According to WHO, World Health Organization, worldwide obesity has more than doubled since 1980. In 2014, more than 1.9 billion adults 18 years and older were overweight. Of these, over 100 million were obese. And most of the world's population live in countries where overweight and obesity kills more people than underweight. So we have to ask ourselves, is this okay? Some may argue that obesity is not that big of an issue in Thailand or in Asia. So here's what I've searched. According to Thailand Business News, obesity has rise and Thailand's overweight prevalence second in Southeast Asia. One main reason, of course, just like I said earlier, it's food. So we are starting a project, this project with an objective to give knowledge about healthy food and to build realization about benefits of healthy diet. We chose teenagers as our target group. Why? Because they are more likely to change eating habits and they are more approachable by social media, which is our main channel to communicate. The project plans are divided into two phases. The first phase is the pre-event preparation. And the second phase is the event day. The sorry. The first phase is the pre-event preparation. We first do a survey to the target group on topics they are interested about, and then we create SCOPH Thailand page on Facebook, and then we are going to open the vote for the separate topics to be um, present on the event day. The SCOPH Thailand page have will be the activities that are going to be posted are knowledge, but we are going to create flashcard, short video, and posters. And then we will have a game to answer questions about food and winning special prize. And the other stuff is what I said earlier, to open the vote for favorite topic. We are gonna give knowledge about it still in discussion, but here are some few of it. Food and weight loss, concept of healthy diet. Nowadays we have so many concepts of healthy diet, which it is still unknown to many of us what is really right and what is really like the concept of the diet. Clean diet, macrobiotics diet, paleo diet. What are the differences? And then we have the benefits of having breakfast: antioxidant, gut microbiome, and health. Drink that increase brain power. In Thailand, there are advertisement about these things, but people don't actually know what it is like. So we will find answers for them. After that, we come to the second phase, the event day. We will have a knowledge corner, and then we will meet the expert by inviting them to give facts about the certain topics, and we'll have fun and game. So here's the timeline of our work. In September, we will be meeting to select the topic and start the SCOPH Thailand page on Facebook. In October, we're gonna create the knowledge flashcards, video and poster. In November, we are still gonna post the knowledge part in our page, and then we are gonna PR our event day, and our event day will be occur in December. Okay, that's all.
All right, thank you, Tritika. Thank you, Miki. I somehow managed to keep the connection while I'm walking. So actually, yes, thank you very much. I'm wondering if any of you NMOs has similar projects regarding on healthy diet. Maybe from the speakers or the audience? Any of you? Okay, well, I guess there is none yet. I think it will be very interesting if any of the animals have similar projects. Maybe it could extend to a project related to obesity. They could keep in communication and try to collaborate and share information and share know-hows and everything. Anyways, thank you very much, Stratika, for your presentation. It was very interesting. And next speaker would be... Thank you. Next speaker would be Asma from Pakistan. Asma?
Yes, hello everyone. Can you all hear me?
Yes, I can hear you.
Okay. So, should I share my video myself?
Yes, please.
Okay, just give me a moment, please.
You muted yourself, Asma. Asma?
Yes?
Can you share your presentation?
Yes, I'm sharing it.
Okay.
Should I send you the link, or am I supposed to share it from Google Hangouts?
Share your screen. You will
Okay,
find
okay.
the screen share button on the left sidebar.
Right, I can see it. Okay. Can you all see my presentation now?
Nope. Click the green button on the left.
It says.
No, I can't see it.
Okay, okay. I'm sorry, just give me a moment. It
All
doesn't
right,
seem
take your time. It's okay. All right, oh, I think we can see your screen.
you can?
We can see your screen. Yes, go on.
Can you see the project
Yes.
screen? Okay.
Yes, I
So
can
should
see
I
your
start?
Prezi. Yes,
Okay.
start.
Good. Um, so basically, my name, can everyone hear me?
Yes, we can.
Okay, good. I'm Asma Ahmed and I'm from Pakistan. I'm a local officer for public health in IFMSA Pakistan. So basically, I was a project director of an awareness project by the name of Smile a Mile, and I will be presenting it here in today's webinar. It comes under the topic of healthy lifestyles, and I hope you like it. Basically, this is the first phase that we completed, and we hope to carry similar projects in future and make it a sustainable program. So IFMSA Pakistan presents Smile a Mile, an awareness project. And
Hello, Asma. Asma? Okay, I think her connection is currently having troubles. Okay, then I guess yes, she is having trouble. All right, I guess we will move on to the next topic. Actually, the next topic will be about APRM. We're gonna continue with asthma when she comes back. Now we're gonna move on to APRM. First, I would like to give a general updates on what we discussed and what we did during the APRM SCOPH sessions. And then I invited a few SWG facilitators today, Unjong and Nikki, who facilitated an SWG on mental health and health education system. So they're going to give a brief introduction about their SWGs, what they've discussed during APRM, and what they've done since so far. So first, I would like to, about the SCOPH brief session, I would like... Hello?
Sorry? Yeah?
Oh, your connection was cut, so we were moving on to the next topic, but now you seem pretty stable. So would you like to share your screen once again? We don't have your screen now.
So you weren't listening to the presentation?
Yes, you weren't connected to the Hangout, unfortunately. Can you share your presentation once again?
Yeah, I'm sharing it. Can you see my screen now?
Not yet.
Can you see it?
It's a black screen.
Wait, give me a moment, please. Can you see it now?
No, we can't. Did you click the green button?
Yes, I clicked it.
Oh yes, now we can see it. Now we can see it.
Should I start over from the beginning?
Yes, please. Can you start from the... Yes. Can you press go? Can you start from the middle big circle?
Okay. I understand.
Yes,
here?
this one. This
Should
one.
I explain
Yes.
it?
Yes, please.
Okay. You can just let me know if you guys aren't able to see the presentation, right?
Okay.
Okay, thank you. So basically, the Smile on Mile is a SCOPH health awareness project, and it targets the local populations living in the rural areas, the villages of Pakistan. And the theme basically is to advocate the importance of health amongst the local, especially the uneducated people, and to instill awareness about the basic problems, the basic diseases, the most common, health issues that arise amongst that population, and also encourage people to adopt a healthy lifestyle. And this was actually one of the most important points. So then the idea was literally that a couple of friends were sitting together and we came up with this idea because most of the Pakistanis, we have, like, even us, we have roots from villages, we belong to villages, and more than 70% of our populations lives in rural areas. So it was literally the urge to do something valuable for our people, and that's how Smile Mile came into being. So, can you hear me? Can you see the presentation, everyone?
Yes, perfect.
Oh, okay, good. So basically, I'm going to take you through the phase one of our project, and we hopefully are planning on conducting other similar trips to different villages in future. So, and the phase one, I was the project director, and my project assistant director, who's in on the webinar as well, was Ikra. And the rest of the team, I just wanted to mention them because they did a really good job. Amna, Anamida, and Rabia, they really helped me out. So the recipe basically is how we planned everything. So there was the general outlay. We made the project proposal. We got approval from the ED. We selected the theme and we decided on the topics. This was a really important point because we had so many topics, but because of the time constraints, we could only focus on three. The rest of the topics we hope to cover in other different villages, and I will tell you what the topics were in later slides. We also had guidance from senior doctors, and this was a really important point because they really helped us. They gave us really important tips and pointers, and one of them, which I want to mention over here, is because we were targeting the village population. uh, they told us that the most important point is to gain their trust. In order for them to follow your advice about health, about different diseases, and tips and pointers, you have to gain their trust, and they should be able to relate to you. So they told us that if you're able to do that, then you're good to go. And then obviously use the local language because they wouldn't understand English or even our national language. Like we have different languages, we have another language normally spoken in villages. So they told us to use that. Then the breastfeeding clinic, one of our topics was on breastfeeding. So half of the team went, they learned and practiced the proper and correct way of breastfeeding in order to teach the locals there in the villages. And we made some posters and pamphlets, and we also bought some fruit for them as gifts. And then it was just we got ready for it. And so basically we live in Lahore, and it's a city in our country, and 6 IFMSians, we drove over there. And the name of the village is Burj Kalan. So you can see the pictures, the team is getting ready, they're making the posters, and okay. So the big day, basically the session just started at 10 a.m. and over 50 local. This for the first phase, we basically focused more on women and children. So over 50 participated in that, and there was a small introductory session where we introduced ourselves. And then the main method that we used for this project were small group discussions. So we divided them into three groups, and each group was headed by two IFMSians, and we gave them presentations on three topics. We explained everything. I will explain the topics in a later slide. Then there was an interactive session. This was really popular. They came up with their different questions and they told us about the problems they face. Free general health checkup was also done, the basic things, because most of us are from we are fourth and final year students, so we have the clinical knowledge and know-how as well. And this was also very popular, especially amongst the older age group of females, And then we distributed fruit bags as a goodwill gesture, and also because one of our topics was on nutrition, so we wanted to tell them, and that eating healthy, like for example fruits, is really important. And we got feedback from the people, and the session closed at around 3:30. So the topics were health and hygiene, breastfeeding, and food and nutrition. And as you can see under the subtopics, these were the main things that we talked to them about. And we also asked them about what they knew about it and how they can change, different things in their village setup. So interaction was a really important point. Personal hygiene, for example, hand washing, under health and hygiene, water and sanitation, how to store water correctly, how to prevent it from, harboring different diseases or parasites, and sewage and waste disposal as well. And we also asked them how, the waste disposal, what was the waste disposal system used in their village and how they could improve it. So breastfeeding was really a popular topic in the sense that the country that we come from, a lot of diseases, they carry myths and stigmas related to them. So we addressed those concerns, and we told them that this is a myth and we shouldn't believe it, etc. And we also taught them the correct method of breastfeeding. It's an emerging trend even in the West, so we felt it was an important topic. And food and nutrition, we explained the food pyramids, and we told them what are healthy foods and um, how they can use different foods in their diet. For example, if someone cannot afford to eat meat, what are the alternatives that they can use, and how to keep fit and healthy in general. And that's why we also, gave them the fruit gift bags in the end, just to, um, um, address the point that, healthy diet is really important. Here you can see the different pictures, with the IFMSC members. They're interacting with the locals. You can see the, different females, and even you might be able to see children over there as well. Um, So the checkup session basically included a general physical examination, measurement of blood pressure, and eye and throat examination. And it was really popular. A lot of people came forward, they wanted to get checked, especially their blood pressures. This was also a way for us to assess them, their health, as an evaluation at the end. So you can see over here, someone is, checking their eyes and taking blood pressure, checking their general, hair, ears, etc. So the name literally just grew from, basically we received so many smiles from the local village population at the end of the first trip, and we thought it was very successful. We felt good about ourselves. And traveling, yes, it's always a really fun and interesting part, because we all live in urban areas. We are from cities, so we have to travel for this project. And this is how we named this project. And the horizon, it's basically that there are a lot of different, we plan on holding similar sessions. We plan on covering different villages. We also plan on including different other topics. For example, we had like topics like communicable and non-communicable diseases like hepatitis and AIDS, which is on the rise in our country, and TB as well, which we haven't yet been able to control, child health and child care, and reproductive and maternal, diseases. So, but unfortunately, we couldn't cover all these topics in one session. So we have planned that we will, cover different topics in other villages in future. And we also had some, after the first phase, we also looked back on it, and there were some improvements that we thought that we can make for the next phase. And then there was the evaluation forms as well, since it was the first phase. We wanted to form like proper evaluation forms and surveys for the next one. For this, we had some feedback and we had some evaluation. For example, we found that around 95% of the population that we examined, they had anemia. And for example, 40% over the age of 50 years had a cataract in one or both eyes. So, this is how we did a general assessment, health assessment of the population. And this is about it. And I hope you like the presentation. And Alpha Pakistan will be really welcome anyone who wants to, do a similar project in their MMO. And thank you.
All right. Thank you very much. Okay. I don't want to share the screen. All right. Can you guys see me? Okay. Thank you, Asma, for a very, very great presentation. I have to say I am really, really impressed. It was very nice. It was informative as well as very clear. Also, I had a few questions to ask. Audience and speakers, you can feel free to ask questions on the comment or chat room. I will later on read your questions for you guys. First, the questions from me is I would like to ask first how many participants you had during the event, and also what was the age group of the participants in general. And also, out of curiosity, I was curious about what kind of myths you have on breastfeeding. So that was my question. Asma, I think you are muted. Can you? Yes, please. Thank you.
Okay, so the age group was the total number of participants were 50 that we recorded, but I mentioned over 50 because some of the females they found out about this event a little later, and so they came in a little late after when we were just wrapping up. So that's why we don't have an exact number, but it's just around 5 or 10 above the normal recorded one. And secondly, the age group was basically we were mainly targeting the female population from 50 to around 60 to 70 years of age. But some of the females they brought their babies or their little children along with them. So we obviously also checked them, and but basically it targeted more because the children they wouldn't be able to understand the presentations anyway. So, but they were included as well. And the last question was, oh, the myths regarding breastfeeding. Well, it's interesting because some of the myths are that the first formula, that contains the colostrum, and basically medically, it is really high in antibodies and it's good for you during the first few days after delivery. Most of the women there think that milk is actually bad milk, and you're not supposed to give it to the baby, which is completely opposite to the concept in medicine. So one of the myths is that. The other is that they obviously they think that the breasts. I was surprised at this, but they think that the breast milk, it's not really a myth, but it's basically they think that the bottle milk or the milk in powders, the powder milk is better for the babies. And most of them are really poor. So actually, breast milk is a really good option for them because they are unable to afford it. But so we wanted to tell them, that breast milk is actually good for you, good for the baby. And apart from that, I think these are I can't really remember the myths, right? The other myths that.
All right. Yeah, that's very interesting. That's enough for my answer. Thank you, Esma. And I guess there is no other questions from the audience. I am not seeing any comments coming up. Okay. So I will move on to the APRM SCOPH session. I will just briefly give you an idea of how we proceed on with the SCOPH session. I've already shared previously, right after the APRM and before the APRM, the report and the agenda and survival kit. I'm sure you'll have the Google Drive for the APRM, and on the Google Drive you can find all the reports and feedbacks and daily reports and photos and everything that you will find from APRM. I will also going to share the address once again later on. But right now, I just want to share you with the screen to show how the SCOPH sessions went. Can you guys hear me? Can you guys? Okay. So, I'm going to share my screen with you guys. All right, can you guys see the screen? Hopefully. Yes? No? Yes? Okay. Yes? All right. So this is the agenda for this SCOPH session. So this is the first day, which basically APRM this year happened from June 27th to 29th in Philippine Manila, and SCOPH session was basically based on small working groups this year. I wanted to build up strong small working groups where each focused on different topics. We had 3 small working groups which focused on mental health, health education, and road safety. So we had 3 small working groups, each talking about their themes. They shared their ideas, they shared experiences, then they shared like how they could overcome their troubles as medical students. All I did was to give them a capacity to come up with ideas and talk about their experience and everything. So the first day, we first went with introduction phase. We normally have this introduction phase in every SCOPH sessions we have. I give them introduction about what SCOPH, I'm going to say SCOPH is, and and secondly, I went with the public speaking session because Asia Pacific scoffers normally go through difficulties about speaking up their ideas and sharing their opinions. So by having this session, I wanted to kind of warm up the atmosphere, and I think it was pretty successive. And then we had a theme introduction session from the SWG facilitators, which was Miki here and Park, and then Lady, who wasn't able to join us today, unfortunately. They gave a brief introduction about their themes, which was mental health and health education and road safety. Then I divided the participants according to their interests. So students divided according to their interests, and then they talked about their themes. They shared what about their experiences. They shared what their NMO's situation is like, and they shared what is the problem currently, and blah blah blah. And then we had program introduction, which is kind of similar to what Omneya gave us today, but rather more general, like what kind of programs we have other than NCD and healthy NCDs and Healthy Lifestyles program. Other than NCD's program, we also have mental health program, we have sex education program, and lots of other programs. But this is not the time to give introduction on that, so I'll skip about that. On the second day, we had the SWG presentation, which is each SWGs present what they've discussed the day before. And then we had a training session where I gave them capacity, what kind of tools they can use to actually interfere with the problem, interfere with the topic, what kind of changes they can bring to their community, what kind of tools they can use to get engaged regarding the theme. So after that, the SWGs once more gathered to talk, brainstorm about what can they actually do and to build up with the plans on the projects, on the activities they can perform. And on the third day, we once had a presentation session to share what they planned the previous day. And sorry. So on the third day, we once again had the opportunity to share each SWG's activities and give comments on each other. And then after, we had a brief introduction about WHO simulation project from Tina Pan, who's from Taiwan. Tina Pan is currently proceeding with WHO simulation project, and we also had a webinar 2 weeks ago about that. You will be able to find YouTube on that webinar. if you look into our Facebook page, I've Miss SCOPH. And she's also going to share the project proposal soon. So if you are interested, you can look into the project proposal as well. And then after we wrap up with our SCOPH session with SCOPH we need, I asked the participants of their opinion how we can improve our work as IFMSA SCOPH, and during the GAs, during the APRM SCOPH sessions, and how can we improve our impacts on our SCOPH projects. Well, this webinar itself, it came from the brainstorming of this session actually. So I think it was pretty effective. Also, I hope this webinar is helping you a lot. So this is it for the SCOPH session that happened during the APRM. And now I would like to invite the SWG facilitators to give a brief introduction on what kind of topics they discussed during the APRM. Mickey, would you like to go first? I don't think Mickey is hanging in there, so Eunjang, would you like to go first? Eunjang?
Yes. Can you hear me?
Yes, I can hear you.
Yeah, I'm gonna first. Yeah, this is the working group report. I'm not going to have a long report. At first, our working group has lots of delays, so our plan in this paper is not fit with our current situation. Anyway, our topic is mental health. Especially, it was started with depression, and our no, depression and kind of stigma about psychological therapy. We shared our current situations among the countries, and then we got a common problems. Yep. This is here, and the common problem was lack of knowledge regarding mental health issues. So we plan to make a promotional video about mental health. After 3 days debate in APRM, we made one online meeting, and then through the Facebook group we contact now. But not yet we made our video about the details. You can find it in this paper. Are there any questions? Yeah, that's all.
All right, thank you, Park. Thank you very much for your brief introduction. I don't think we have Mickey back. So I shared a link to the Google Drive on the comment room. You will be able to find literally everything about our APRM SCOPH session. What happened there, the agenda, the schedule, the minutes, the photos, the report, everything. So if you are interested to look into what happened during the APRM, it is open for all of you to go have a look in it. And I think that is it for today. Have I missed anyone? Any speakers that I missed? I hope not. Okay, guys, I think that was it for all of us. Every speaker has done a very, very good job. I really appreciate your efforts and your inputs. And I will also once again would like to promote a collaboration in between you guys, you NPOs and you SCOPHers, with the works you're doing in your NMOs. I already see lots of similar topics that you guys are performing in your NMOs. So there was a project on healthy diet, there was a project on health education, which is all related to NCDs in the end. So thank you very much. Lastly, I would like to ask one opinion from Omneya. I'm not sure if she's still in here. Okay, I think she lost her connection. Well, anyways, thank you very much, guys. Thank you very much for tonight, for being here with us. Thank you also, speakers, for giving such a precious and fruitful speeches today. I think this is it for tonight. Thank you again, and I hope you guys all have a good night. Thank you.
Thank you, Oyun. Thank you all. Good night.